Hey Tumblr and YouTube, so I've recorded this video like 3 times and I don't want to do it anymore. So hopefully this one comes out right. I wanted to make a video about sickle cell disease for Sickle Cell Awareness Month, which was in September, but didn't get to make it. So I'm making it now, a month late. Okay, so basically what I have sickle cell anemia, and that's a form of sickle cell disease. And you get sickle cell when both of your parents have the sickle cell trait. So that means that they have one gene for sickle cell in their genetic code. So when your mom has sickle cell trait and your dad has sickle cell trait, they make you, and you have both copies of that gene. So that's what sickle cell disease is. It's a blood disease. It is not contagious. It is not caught in any way, shape, form at all. If you're born with it, you have it, and that's it. You can't give it to anyone, and they can't catch it from you. Okay, so that's pretty important. Don't want there to be any misconceptions about sickle cell. Okay, because people be asking some ignorant stuff. Okay, and what else? Okay, so sickle cell is basically when your red blood cells are usually shaped like this, and they're bouncy and movable, pliable. They move on through your blood cells very easily. When you have sickle cell, if the weather gets too cold, if you don't drink enough water, if you run yourself down and you get really exhausted, your red blood cells will turn into this shape, a sickle. See where the name comes from? And in addition to being shaped as a sickle, it'll get sticky. So you have these misshapen, sticky blood cells moving through your veins, and it'll get stuck in there. And this is really, 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 really extremely painful. It hurts a lot. And a lot of people with sickle cell like to act like it doesn't hurt a lot because, we're warriors and we can't be, weak. But I will tell you, for everyone who doesn't tell you, it hurts a lot. It is very painful and it sucks. And so when you're having this, is called a sickle cell crisis. When the sickle cells get stuck in your veins and stuff, this is called a sickle cell crisis. And the only thing you can do is, if you have a sickle cell crisis, is to go to the hospital. You have to go to the hospital. Okay, I know. Go to the hospital. Because I know a lot of people hate the hospital. I hate the hospital. No one likes the hospital, but you need to go to the hospital if you're not feeling well. And the doctors will pump you full of fluids and pain medication. And if your hemoglobin's really low, then they will give you blood transfusions until it comes up. That's I can make a whole nother video on blood transfusions, but doctors don't like to give you too many in a year or at the same time, because over time it's not good for you. I don't know. That's a different video. And yeah, that's basically the only treatment. Pain meds, fluids, blood transfusion. That's it. There's no cure for sickle cell. The only cure really is to get a bone marrow transplant. And that'll help your bone marrow produce all new blood cells. And that's also a treatment used for cancer patients. So there's a lot of similarities between sickle cell and cancer, because it is a terminal illness and it is a chronic illness. And it's related to like with leukemia, it's in the blood, it's in the cells, the body cells. What else? If you know someone who has sickle cell, you have a friend with sickle cell, family member with sickle cell, I know we like to act like warriors all the time, and we are warriors, but it does hurt, and be patient. And if we disappear for months at a time, it's not because we hate you, it's because we're sick. And I know depression and mental health with someone who does have sickle cell, it can be difficult. And I know in the black community and with people of color, no one wants to talk about mental health issues at all, ever. And if you do have sickle cell and you do feel stressed out, and if you do feel sad because it hurts and it's not going away at all, that's the courage you got. You know what I mean? It's okay. Okay, I wish like I did have someone to tell me that when I was younger, that it's okay to feel sad that you do have sickle cell. And it's okay to be stressed out because you know that it's something you have to live with forever, and it's something you didn't ask for, and it's painful. But you're a superhero. You're awesome, and you got this. Okay. What else? Okay. So daily treatment for sickle cell. Daily treatment starts here. Drink water. Drink lots of water. If you don't drink water, go drink water now. Like, you need to drink water. If you have sickle cell and you're not drinking water, you're not taking care of yourself, and you need to take care of yourself. That's really important. Since I've started like eating better and stuff like that, I feel healthier. So it's really important to have like water and stuff, and drink water and be healthy. This is hydroxyurea. I take 2 of these, 500 milligrams every single day. Sorry, my camera's so bad you can't really tell what I'm doing. But yeah, that's hydroxyurea. That helps with fetal hemoglobin. The higher your fetal hemoglobin is, the lower your chances are to sickle. So hydroxyurea is good stuff. I know for everybody it doesn't work well. I highly suggest it. Talk to your hematologist. This is ibuprofen. This is 800 milligrams of ibuprofen. That's why the pill is so big. That's for daily pain due to sickle cell. And this is oxycodone, also known as Percocet, also known as, I don't know, hydrocodone too. It's strong pain medication. If you want to do home care, that's when your sickle cell crisis isn't quite like you think you can take care of it at home without having to go to the hospital. I know a lot of people with sickle cell too don't like going to the hospital all the time because you can get sicker because when you do have a crisis, your immune system's really low, and the last thing you want to do is to go to a hospital around a whole bunch of sick people. So if it can be avoided, I know like when you're having a sickle cell crisis, if it's bad enough to go to a hospital, if you feel like you can take your medication, drink water, get your heating pad, and stay at home and treat it at home. So that's what the Percocet's for. What else? I want to talk about complications due to sickle cell. Like I said, there's no cure. Because you are sick a lot, the doctors need to start IVs and stuff to get blood and to give you fluids. So I had a Metaport, and a Metaport is a metal plate with a tube attached to it, placed under the skin, and the tube attaches to a vein. And so when the doctor sticks the IV inside of the Metaport, it connects directly to a vein, and they can put fluids in and take blood out. I had mine, obviously. As you can see, I have 2 scars on my chest from having a Metaport put in, taken out, put in, taken out. And the reason I don't have a Metaport anymore is because now that I'm older, my veins are slightly, ever so slightly better. I also have a hip necrosis. I had a sickle cell crisis, and the bone died. And so like with your hip, it's like this. There's the ball and like the socket or whatever, and like the top of the bone is basically dead because blood couldn't get to the bone, and so it died. And I'm supposed to get my hip replaced, but I don't have 6 months to take off, so I haven't done that. And I've had that since 8th grade, since I was like 14, 15. What else? I don't have a spleen. I don't have a gallbladder because the sickle cells were getting stuck in those organs, and it was making me really, really sick. So the doctors took it out. So I don't have that. If you know someone who has sickle cell, don't treat them any differently from someone who does. That's still your girl and that's still your boy regardless. Don't ask stupid questions. Don't treat them like, oh, I don't want you to do that because I don't want you to hurt yourself, or oh, I don't want you to get sick. You know what I mean? Don't treat them like weird, I guess. I know my friends will be like, you need to drink water, or you need to do this and that. And I appreciate them so much because, like there's like a right way to do it. You know what I mean? Like, don't make it creepy and weird. Just be like, hey, I'm looking out for you. You need to take care of yourself. And that's just, it is what it is. If you have sickle cell, comment below and tell me what type you have. And I'll probably put my Tumblr link in there. And so ask me some questions. I think that's it. Alright, maybe I'll make another video. I don't know. We'll see. Alright, bye.